Our next presenter is someone who many of you in the room may know already through another carrier, that she kind of switched teams this last season. Kathy Toll is the Medicare head of sales for Baylor, Scott & White. So would y'all please put your hands together and bring Kathy up with a warm welcome.
Good morning. Boy, I am so excited to be here this morning. I think I know 95%, or not 99% of the individuals in the room. And I think I probably spoke to you, most of you already with some of our road shows. So welcome. We're going to go ahead and get started. The next slide is me. We were told we had to have a picture. I don't know why. I think everybody knows me. Again, I'm the sales manager for Texas with Scott & White. Again, really excited to be here. I have two sales reps with me as well. Actually, Jared Nord he's in Round Rock doing a presentation, but I have Chris Iona in the back. Chris, stand up. Thank you, Chris. He is actually my rep for east side of Texas, so Collin County, Dallas County, and if you take 35 all the way down, he's going to be on the east side. And then Jared's the sales rep for the west side. So please stop by the booth so I can introduce you to the team, and then you can grab their business cards. All right, well, we're going to go ahead and get started. So being ready to sell for Scott & White for 2016. Who in here sells Medicare? Who in here is ready to sell Scott & White for 2016? Awesome, that's great. Well, if you're not ready to sell, or if you're brand new to Scott & White, there's a few things that you need to do. The first thing is we do need a copy of your AHIP certificate. That does need to be mailed to Scott & White. You can see the email address on your screen, and you can also see the fax number. So be sure and send us a copy of your AHIP. We're hoping by next year that we can go ahead and it'll automatically feed over from AHIP. But this year, for 2016, we still need a copy of your AHIP. In addition to that, you need to be certified, right? So you have to go in and do that one certification course. Those of you who are ready to sell with Scott & White know how simple and how easy that one course is. We did not take you through all of these different courses to be able to sell our product for Medicare. So again, you have to be certified. You need to submit your AHIP, and if you're a brand new agent to Scott & White, of course, you have to be licensed and appointed to sell our products. Once you're ready to go, once you're ready to get out there and start selling, we're going to issue you an agent writing number. Again, this is one thing that I hope that changes for 2017, where we go to using your NPN, but for 2016, again, you will be issued an agent writing number. If you're a current agent, you already have a writing number with Scott & White. Here's our footprint. So I'm going to talk about what we have to offer throughout the state of Texas. We have in North Texas, we have a Medicare Advantage plan. We are actually adding Denton County to 2016. I got a lot of feedback from Denton County that we were not in that county for 2015, so we are adding it for 2016. Lots of opportunity in Denton County. And then also we have the 6 other counties. So in North Texas, we have 7 counties. And then in Central Texas, we have our cost plan. Who knows what a cost plan is? You know about it because you had to take it on your AHIP. That's the only reason you know about it, unless you actually sell in Central Texas. Cost plan is not a Medicare Advantage plan, and it's not a MedSup plan, and I'm going to talk about that in a few minutes because, guys, you know what? This plan you can sell year-round, and it's located in 60 counties throughout the state of Texas. So a huge opportunity for you to make some sales during lock-in or even during open enrollment time, and we'll talk a little bit more about that. So again, here are our 2 plans. So for 2016, we are going to continue with our HMO plan, and we're adding a POS plan, so a point of service. Guys, this is going to give your clients huge flexibility to stay in network, take advantage of those low, zero copays, or go outside the network, and guess what? They're only going to pay 30% co-insurance for their medical, and we're going to talk about that a little bit more. And here you can see our cost plans, which are throughout those 60 counties, as I mentioned. So again, why Vital Traditions? We are located in all 7 counties. Guess what? We have our HMO and our POS plan in all 7 counties. It's not separated. Very simple plans. We have one direct formulary for both of our plans. We don't have one direct formulary for one HMO, another one for the other HMO, another one for a PPO. We have one direct formulary, so very, very simple. And I know you as an agent, when you're sitting down with your clients and you're trying to figure out what direct formulary goes with what plan, we made it very simple for you. So I hope you take advantage of that. Also, open access. So there's no referrals required for our members to see a specialist, so that's a huge selling point as well. Mail order drugs. Why do I even mention mail order drugs? Well, a lot of our competitors out there, they have mail order drugs. Most carriers do, but it's more just of a convenience for their clients, for their members. Well, with Scott & White, we still have that 90-day supply for the 60-day copay, so still saving your clients some money there. And then, of course, we have those added value benefits as most of the other carriers do. So we have the vision, we have the hearing, and we have the free gym membership, which is through Silver and Fit. In addition, we have a rider. We have a optional dental plan. It's through MetLife, and we'll talk about that in just a few minutes as well. Next slide. And here is just a quick overview of our Medicare Advantage plans. Again, for our HMO, it's very simple. 0 PCP copay, 0 premium, of course, $30 specialist. But what really should stand out with this plan is that inpatient copay. Inpatient copay is only $150 a day for days 1 through 5. Also, the max out of pocket is extremely low, and you can see what the RX copay is there. But what I want to focus on is that point of service. Again, this is going to give your clients such huge flexibility in staying in network, or they can travel outside the network. They can travel to Florida, they can travel to California, and utilize their out-of-network benefits of 30%. But what I want you to look at is that max out-of-pocket. And I want you to know, and you guys that's been in some of my classes recently have heard this, I checked this 3 times. That max out-of-pocket is in and out of, that's the combined in and out of network. So $5,700. So your clients can utilize their in-network benefits, they can utilize their out-of-network benefits at 30% co-insurance, up to $5,700. That's the ceiling that they're gonna pay for 1 year. Huge, huge benefits. Also, that inpatient for the POS plan, it's only $250 a day for days 1 through 4. I think you're gonna find that extremely competitive as well. Let me just talk about, I'm going to talk about the pharmacy on the slide before, because on the out-of-network portion on the POS plan, I just want to make it clear that you're aware that that out-of-network 30% only applies to the medical. It does not apply to the pharmacy. We have all the national carriers with regards to the pharmacy, so we have the CVS's, we have the Walgreens, we have the Kroger's, we have the Albertsons, we have the Walmarts, we have HEB in Central Texas. So we have all the major carriers along with several mom and pop carriers. So again, they still need to utilize an in-network pharmacy, even though they're out of network using that 30% co-insurance on the medical. All right, next slide. So a cost plan, and why am I even talking about it? Because the cost plan is located in 60 counties. It's year-round selling. It's not a Medicare Advantage plan. It's not a Med-Sup plan. I like to call it a hybrid plan, or maybe a Med-Sup on steroids. They like to call it the enhanced medical plan. It is a great plan because what happens, if they want to stay in network, they take advantage of the low copays, 3,500 plus physicians in Central Texas that they can take advantage of. But if they want to go outside the network, if they want to travel, guess what? They can do that. And what happens? It actually reverts back to original Medicare. So then it reverts back to where they're paying 20% co-insurance. This is a great plan. Also, we have 4 different medical plans with the cost plan, and we're going to talk about that on the next slide. Those 4 different medical plans, our clients, your clients, our members can choose to change from one medical plan to another medical plan within the same year. So there's, again, lots of flexibility. Let's see, what else is there on this plan? Because I love it. I think it's a lot of fun. So whenever you're finished up with open enrollment, you might want to spend some time in one of those 60 counties, and that might be a great marketing strategy for you during lock-in. Also, with the cost plan and how it resembles a little bit of a Medicare Advantage plan, is that it still has those added value benefits. It has a vision, it has a hearing, it has that great free gym membership through Silver and Fit. A Med-Sup doesn't. but a Medicare Advantage does. So you can see how it acts a little like a MedSup plan and a little like a Med Advantage plan. It's that hybrid plan that we call it. All right, next slide. And here's just a quick overview, and I know it's probably small where some of you guys in the back probably won't be able to see it. But if you come by the booth, we can talk to you more in detail. Again, there's 4 different medical options. These are medical only. This does not include the drug portion, which we're going to talk about next. We do have 3 different drug opportunities as well. They're not standalone drugs. They must purchase one of our cost plan, one of our medical plans in order to get the pharmacy. But again, if they want to choose one of the medical plans and go out and purchase a standalone Part D with another carrier, maybe a really low Part D carrier, then they can do that. They were able to do that. Again, the most popular plan that we sell at Scott & White is that premium plan. Guys, that's a $177 premium plan, monthly premium. We have a 0 premium plan, but that is the most popular plan. You're thinking, why? I mean, I know in North Texas, everybody's used those 0 HMO plans, but if you think about this, this is a cost plan. If you have someone out there that's on a MedSup plan and they're 70, 80, 90 years old, what are they paying monthly in premiums? $300 plus a month? This is a great alternative to those individuals that are on a MedSup plan. And again, you can enroll them year-round. It's not just you're in open enrollment with these plans. Again, it's $177. And see how it resembles a MedSup? 0 PCP copay, 0 specialist copay, 0 inpatient hospital copay. That really acts like a MedSup a little bit, doesn't it? But if you go over, you see where it has those added value benefits as well, where again, it starts resembling a Medicare Advantage plan. All right, next slide. Now here are the 3 prescription drug plans that we're offering. Again, these are not standalone. They must select one of the medical plans in order to get one of the pharmacy plans, but there are 3 different options for our members. Next slide. And here is our optional dental. For 2015, we are going through Delta Dental. 2016, we're moving over to MetLife, so that is a change. Again, it's only $17 a month for the DFW area for our Vital Traditions, and only $13 additional a month for the cost plan. This plan includes dentures, guys. This is a PPO plan. It's a comprehensive dental plan for only $17. The max annually is $2,000 in a DFW area. That is a change from 2015. What a great selling feature whenever you're talking to your clients about their medical. Most seniors want a dental plan. That's what they're looking for, is a dental plan. This is going to give your clients a great dental plan at a very low cost whenever they come on board with Scott & White. And the Silver and Fit. I know most of you out here know a little bit about Silver and Fit. I think it's a great company. I have a great relationship with Silver and Fit. Again, this is a huge selling factor whenever you're speaking with your clients. This is going to give you the opportunity to make a sale in some cases, because a lot of seniors do work out. They want to work out, and just knowing that they can work out for free, no cost, if they join one of our medical plans, that is a huge selling feature, and I just don't know if we talk about it enough with the clients. So again, through Silver and Fit, they have like the Cadillac of all the gyms in the area, which is Lifetime Fitness, 24-hour fitness, Gold's Gyms, Curves, YMCAs, lots of small mom and pop workout facilities as well. You can always go to silverandfit.com and pull up the list of gyms in whatever zip code or city that you're looking for. Commissions. We do pay, and we will continue to pay the highest allowable commissions that CMS will allow us to pay. So for 2016, I'm not going to give you that amount. You can go out there and look at the amount. I think it's $429, but we do pay the highest allowable commissions. Also, starting, can you go back one? Thank you. Also, prorated commissions. We prorate commissions in 2015, but guess what? In 2016, we're doing away with prorated commissions and we're paying full commissions. I see some people up here at the front. Yes. Again, that's for the first year and starting in 2016. So what do you do now? How do you order kits? How do you get ready to sell Scott and White? Well, you need to request your enrollment kits. We call them pre-enrollment kits or PEKs. I highly recommend, and I know some of you out here have already done this, I highly recommend you email IM agents at the email listed on your screen. It's IM agents with an S at sw.org. You can always call, but again, I highly recommend you email with your name, with your mailing address, and what are you needing from us? Are you needing Vital Traditions, and how many Vital Tradition kits are you looking for? I think the cutoff is going to be 15 for the initial order. What about senior care? Do you guys want to try to sell some senior care this year? Let us know, and we will send you some pre-enrollment kits for senior care. Also, we don't mind sending you guys provider directories. We know that when you're in a client's home, you're sitting there, our seniors, they want to look at a book still. They want to open up a provider directory and see their doctor in that provider directory. Guess what? We don't mind sending you those provider directories. Let us know in that email if you would like a couple of provider directories, and we will get those to you as well, along with drug formularies and anything else that you're needing from us. Just put in that email, and we will get that to you. The kits will be mailed out around the 28th of September, so please, if you're wanting those kits early, you need to get that email sent to IM agents. Also, the phone number that's listed there, we call it IM agents. That was prior to the new sales team coming on board. It's agent support. That's what it is. It's just agent support. The phone number's listed there for agent support. But again, I highly recommend, as I think it was Humana that mentioned, you know what, you have an upline, go through your upline. They can probably get you the correct answer a little bit faster than agent support. Agent support, I think with all carriers, are extremely busy trying to get the contracts in place, getting all the certification in place, and answering questions from new agents. So again, you definitely utilize your upline. And the websites, online tools. Again, we also want you to do business. It's so easy to do business with Scott and White, and you can do that by going to our website. If you go to swhp.org, that is our main website. So if you do under 65 business, if you do group business, if you do Medicare business, this is that one website that you will go to. If you click on Vital Traditions, it's going to take you to the Vital Traditions website. This is where you're going to pull up your provider directories, the formularies, the summary of benefits, the EOCs, everything that you need to do business with us. You're going to be able to find it on these websites. There's also a website for senior care. So you can go to senior care and to their website and also pull up their information as well. All right, and I have under 1 minute. So again, thank you guys so much. I'm excited to be here. Please stop by our booth and visit with us. Thank you.